President Cyril Ramaphosa said they're in discussions. The president saying they're in discussions with other vaccine manufacturers so the country is able to include different vaccines in the program. He said some of these manufacturers are in the process of seeking the necessary approvals from Health Products Authority, SAHPRA. The president was addressing the nation on the country's response to COVID-19 infections last night. We have the CEO of Proactive Health Solutions, Dr. Fundile Nyathi, to talk to us about this. A very good day to you, Dr. Nyathi. Thanks for making the time.
Good day to you and good day to your viewers.
How important is it to have a variation on vaccines as part of the program?
Well, it is very, very important that we access vaccines from any supplier that is, able to give us those vaccines. Because when you have just one or two suppliers and something goes wrong with one of the suppliers, it has got a serious impact on the rollout. For example, at this moment, there is a problem with the J&J vaccines, something that went wrong in a plant in the US, and all the J&J vaccine manufacturing plants across the world have now been stopped, and that is affecting us. So if we had 4 or 5 different vaccines like they had originally thought that they were going to have 4, then we would not be in the current situation that we're in.
Why is it, do you think, that Moderna is not in the mix of conversation in terms of possible vaccines?
Well, in the initial rollout plan, Moderna was one of the 4 vaccines that were earmarked to be bought for South Africa, but it was going to constitute only about 5% of the total, vaccine supply. I guess it could be related to the fact that Moderna is the first time that they manufacture vaccines. And so their capacity to deliver in the US and also deliver in the world is quite limited. So I think that is the issue more than anything else.
So when South Africans are trying to make a decision about whether to vaccinate or not and which vaccine to go for, do we have these choices? Do we have the option? Do we know the levels of efficacy of the different vaccines?
Well, that information is available, but I must also be critical, on our government in terms of public health education, because each one of these, starting at the beginning of November last year, they would announce the efficacy from the phase 3 clinical trials. They would announce issues of safety, and that information we know and we have. Even now that there is the new variant here in South Africa, again, we know which of these vaccines work with that variant and which ones don't. So I think what we need to do, though, is to share this information widely and also not only speak in English, speak in the languages, in the 11 official languages of South Africa, because people do not understand some of the things that are announced because we speak in English.
Do we know how far the resolution is in terms of the J&J vaccine issues? How long will it take to arrive in the country?
Look, it's not a matter of arriving in the country. The J&J vaccines are ready. They are waiting at the Gqeberha, Aspen manufacturing plant. All that they are waiting for is a go-ahead from, FDA in America and also J&J head office. Otherwise, by now, they would have, supplied us with millions of vaccines because they were ready already by late April. So we are in a situation where, because we live in a global world and the head office of J&J together with FDA, they want to make sure that the problem that happened in the plant in America does not happen here again. So that is the reason. But otherwise, the vaccines are there. If they can tell us today, I'm sure within 7 days, those would be, distributed in the rest of the country.
Yeah. And also one challenge that keeps coming up in terms of Pfizer, and the president mentioned this as well yesterday, challenges with storage and cold storage. How has this impeded the process of vaccination in the country?
Yeah, look, like the president mentioned yesterday, the Pfizer vaccine, is made of what we call mRNA type of vaccine. Now, it requires extreme cold storage at around minus 70, 75 degrees. Now, obviously, as a country, we don't have enough of that capacity to store vaccines at that level. In fact, in the first week, my home province of Eastern Cape was struggling, with that. So that is the challenge. So in the plan, the Pfizer vaccine was going to be used mainly in the large urban centers, whilst the J&J vaccine, which is easily stored at normal fridge temperatures, was going to be used in the more outlying areas. But anyway, in the interim, about a week ago, Pfizer has since come up with amendments that we can now keep the vaccine for 31 days at normal fridge temperatures instead of the 5 days that it was before. So that gives us, when I say us, the country, some breathing space that we don't have to finish these vaccines, within a 5-day period once they are out of the minus 70.
So you spoke earlier about some vaccines still needing approval from the FDA, but let's talk about Sinovac and Sputnik. Their procurement falls into the realm of politics as well, because Russia and China are both BRICS members with South Africa, along with South Africa. What do we know about Sinovac and Sputnik and their efficacy?
All right. I know that, when we look at South Africa, we are more closer. I'm not talking about at a country level, but historically, we've always been more closer to the West, and we trust things, from the West. But we are part of the BRICS, and China is an emerging powerhouse, obviously with Russia there. Now, with all of that, when we look at the efficacy of these vaccines, the Sputnik vaccine from Gamaleya, that is the Russian vaccine, is actually quite effective at about 84%, and also very, very safe. In fact, their studies were published at the well-respected Lancet magazine, which is something that the others had not yet done. So from a safety and the quality point of view, they are quite good. What we do not know, though, is their performance on the variant that was found here in South Africa. When it comes also to Sinovac, which is the vaccine that is from China, that also, is effective, but maybe not to the same level as to the other vaccines. So I think more studies need to be done there, but also on the variant that has been the main driver of our second wave here in South Africa.
The president also spoke about a new delivery coming through with all the politics around the Minister of Health and challenges faced by the Department of Health in terms of rolling out their digital, their data system, the vaccine data system. What are your predictions in terms of the coming days and weeks in terms of South Africa's rollout process? Will it pick up, or are there still challenges to deal with?
Yes, I think, we need to look at what has happened elsewhere in the world to also have a sense of what's going to happen here. Now, already, we started the phase 2 vaccination on the 17th of May. And on that day, there were only just over 4,000 vaccines that were given. But by Friday, in fact, Saturday on the 29th, we had 65,000 vaccinations in one day. By the end of today, South Africa will have vaccinated more than 1 million people if they keep, that 60,000. Because we were short of just about 37,000 to hit the million mark. So we are definitely going to improve the numbers as a country. Those sites that were earmarked for J&J have not really been opened, especially in the outlying areas. Once that has been sorted, then we will actually, do very well. Even at this pace, by yesterday, we were number 8 in Africa in terms of vaccinations, with just a few countries above us. So the majority of countries in the continent are actually far, far, far behind us. Sometimes people will comment and say, we are doing so badly. We're not doing that badly. We are number 8. And within the next 4 weeks, we will definitely be in the top 3 if we're not number 1 in the continent.
So we're asking our viewers today, we're on lockdown level 2, just in terms of how this will help in terms of the runaway infection rate in the country. What are your thoughts on this? Is level 2, putting the country on level 2 going to help?
Look, because the economy has been damaged so much by the previous lockdowns, I think this time around, the Command Council decisions, as communicated by the President, are actually quite lenient. There is a steep rise in terms of infections, especially here in Gauteng. We had about 15,000 active cases already, by yesterday. And other provinces like Northern Cape, Northwest, Free State are also doing very badly. So I would have expected that they would tighten the key drivers of the infection. And one of those is the consumption of alcohol. Because when people have consumed alcohol, they do not observe these measures. So they didn't make any announcement. I would have expected that maybe from Thursday up until Sunday, no sale of alcohol, not a total ban, but they didn't do so. And my worry that even though they've decreased the numbers from 250 to 100 indoors, that will still not make much changes in what happens in the taverns and other areas where people meet. So for me, that's a missed opportunity to impact on something that has actually shown that if it is managed appropriately, then it does decrease the spread of infections.
Dr. Fundile is the CEO of Proactive Health Solutions. We're going to take